Alrighty, so we will continue and we will get started with today. So thank you all for joining. My name is Kimbrough, and I'm a program coordinator for the Centers of Wellness for Urban Women. Today, we are partnered and supported by Grail for Detect Early, Treat Better. So this webinar is going to learn and teach you all the importance of screening and early detection for cancer. So as I mentioned, this is a health webinar hosted by your very own health advocates and supporters to discuss the importance of early detection and prevention. Our agenda today, we're going to have some opening remarks, just an overview, and then a Q&A with our panel. And then we will have a survivor point of view and Q&A, and then we will close out. As I mentioned, I work for the Centers of Wellness for Urban Women. Our mission is to empower women and their family living in urban communities to take action in their health and well-being through education, advocacy, prevention, and care. We do all of these through the 7 dimensions of wellness to create a stress-free and balanced lifestyle and support healthy living. We believe that addressing all of these dimensions leads to a healthy decision-making and a healthy family structure. Today, our topic is cancer screening and early detection. The importance of this is when cancer care is delayed or inaccessible, there is a lower chance of survival, greater problems associated with treatment, and higher costs of care. Some of the recommended cancer screening tests include having a mammogram, the HPV test, lung cancer screening, multi-cancer detection test, and then also skin exams. Now you can meet our beautiful panel. As I mentioned earlier, my name is Kimbrough, and I will be moderating today. And then we also have Kast, is a Indiana Grassroots manager with the American Cancer Society Cancer Action Network. She's in the advocacy branch. She works with cancer patients, survivors, and their loved ones to advocate at the local, state, and federal levels for stronger cancer-related legislation and policy. Ali empowers her volunteers to share their stories and use their voices to move lawmakers to help and save thousands of lives. Thank you, Ali, for joining us. We also have Lisa Hayes, is the Exec Director of Pink Forever, Ending Disparities. Lisa has served socioeconomically challenged populations as a lawyer, administrator, community collaborator, and a barrier-busting advocate. She's a certified patient navigator and certified community health worker. Lisa's commitment to breast cancer education and advocacy is influenced by her personal experience as a 15-year triple-negative cancer survivor. Thank you for joining. We also have Jayla. Thompson is from Indianapolis, Indiana, but currently lives in Greenville, South Carolina. She received her Bachelor's of Science degree from Ball State University, where she studied biology. She's a clinical research associate with Kiyatec, Inc., which is a biotechnology company committed to cancer research. And we also have Crystal Taliefero, is a vocalist and multi-instrumentalist. Crystal has been with Billy Joel since 1989. Over the years, Taliefero's music journey has included a wide range of artists. She's also a triple-negative breast cancer survivor. Thank you for joining.
Thank you.
And now that we have introduced everyone, we can continue with our panel. One moment. So I will start the discussion with, and I will ask everyone if you would like to respond. The first question is, what is your organization's goal and what types of services are provided? And
Want
Ali,
anybody to start?
Ali, you can go first, and then we'll just go in order from Ali, and then Lisa, and then Jayla, and then so forth.
Awesome. Well, thank you again for having me today. I'm excited to be here with all of you. So I work with American Cancer Society Cancer Action Network, which is our advocacy branch of American Cancer Society. So we work with patients, survivors, and their loved ones to help advocate for stronger cancer-related policies at the state, local, and federal levels. So a lot of our work that we do is sharing stories and using our stories of our volunteers, our survivors, patients, and loved ones to help push for stronger cancer-related legislation. So our mission is hopefully to end cancer for everyone. We have a lot of goals built around that. We work hand in hand with American Cancer Society, the research branch and patient support, as well as our development pillar to make sure that that's accomplished.
Thank you.
I think I'm next. As was stated in the introductions, I'm Lisa Hayes. I'm the Executive Director for Pink Forever Ending Disparities. And our mission is to eliminate breast cancer disparities for Black women through our pillars of education, advocacy, research, and empowerment. So under each of those 4 pillars, we have a variety of programs and initiatives that will essentially address the breast health needs of women and families across the entire continuum of care. So I don't think we have time for me to go through all of those, but I'll highlight a few of particular significance. One is our Breast Health Advocate Initiative, through which we train women to serve as advocates within the community and to be a resource for women in the community for support, for connecting them to other community resources, as well as connecting them with all the services that Pink Forever offers. And then we also have our mammography assistance program. So if someone is uninsured or underinsured and needs access to a screening mammogram, we are able to provide that for free. And then through our partnerships and collaborations with other community-based organizations, if they need any follow-up testing beyond that screening mammogram, our advocates help to arrange for that. Then we also have our research arm through which we do some of our own research, but then also partner with academic and other community researchers to look into, find out more specifically why disparities exist, particularly in Indianapolis, for Black women, and then take that data and develop programming and initiatives that are designed to specifically address what we have found. And so one example of that is our CIS, Support and Empowerment Group, which sort of falls under, obviously, our pillar of empowerment, but that group came about as a result of a research project we did with the IU School of Public Health, Fairbanks School of Public Health, as well as some of us, just our own experiences, that Black women needed a stronger support system while they were going through treatment. And one that was culturally sensitive to them and their families. So that's how we developed CIS, which stands for Sisters Inspired to Stand. So we have that. And then the one other thing that I'll mention is we also have our Nadine Whitlock Hayes Assistance Fund. and I'm sorry, Legacy Fund, but it provides assistance for women who are in breast cancer treatment that may have suffered some financial fallout challenges from that diagnosis and treatment. And so we can provide assistance for things such as rent, food, transportation, utility costs, and so forth. So that's just the highlight of some of the many services that we provide.
Thank you. And Jayla, you can go next.
Hi, thank you for having me on this wonderful panel. I'm excited to discuss some important topics. But I work for Kiyatec Incorporated, and essentially it's a biotechnology company that is committed to cancer research, and we also have clinical trials. So we have developed an assay within our lab that can predict patient-specific outcomes based on their tumor response to different chemotherapies. So essentially, we take live cells from their tumor and we put it under our assay, and we have a panel of chemotherapies that we see if the tumor cell will respond to that specific chemotherapy or not. And so the overall big picture of that is we want to decrease the amount of failed chemotherapies for the patient so that they can find something that or utilize something that works for them so that they can go into remission a lot quicker. So that's really our main focus, and we have clinical trials that we use to see if what we predicted is correct, if we were right about it. So far, we have been pretty spot on. So yeah.
Thank you. And I will go to my next question. What can increase the risk of development of cancer? And what kinds of people should consider genetic testing? And
jump in or what?
Anyone can answer this question.
That's somewhat of a multi-layered question, but I'll start with the importance of knowing your risk factors, your personal risk factors for really any kinds of cancer, but obviously my area is breast cancer, but I'll talk specifically about breast cancer. I think it is important to point out that less than 10% of all breast cancer diagnoses are based upon a family history or genetic history of breast cancer. So although that does increase your risk if you have that family history, there are a whole lot of other factors and reasons why you might at some point be diagnosed with breast cancer. So again, knowing that, but then also knowing what are your other risk factors. And it's personal to each person. So, but I could talk generally just about some things such as lifestyle. That includes your diet, your weight, how much exercise you get, your alcohol intake. Now, those are things that you have some control over, but there are some other factors that you don't have control over. Of course, one of those is your family history, but then also things such as at what age do you start your menstrual cycle? What age do you go into menopause? How many children do you have? At what age did you have your first child? Another factor is whether you breastfeed or not, and that is a choice. So all of those things are important in terms of looking at your personal breast cancer risk. And I'll just take a moment here to plug something that one of the new initiatives that Pink Forever has is to promote the use of a breast cancer risk assessment tool that was designed specifically for Black women. This came out of the Black Women's Health Study, which has been going on for more than 20 years that was initiated at Boston University. But out of this study, which included data from only Black women, they have developed a risk assessment tool that is specifically for Black women. So in that, it works better than some of the tools that are being used currently. So we are working now to implement a program for use of that tool by clinicians in the clinical setting, but as well as by individual women within the community so that they can know their specific personal breast cancer risk. And then as a result of that, what action they should take based upon their own personal risk. And I'll stop there.
I love that. I love that. Thank you for sharing.
Mhm.
All righty, and we'll go to our next question. Why is it important to have a good relationship with your primary care physician or improving your communication with your doctor? And Allie, would you like to answer this question?
You know, I will defer this to the other two panelists who work more directly with research and with patients. I think it's great to have someone advocating for you and being able to have honest and truthful and open conversations with someone that you can rely on, right? But I'll defer to the other two for this because I'll keep the policy advocacy part out of this one.
I would just say, first off, it's important to have a PCP that you are comfortable with. And comfortable having these discussions with, because if not, it kind of makes it a little bit more difficult to want to open up to them about things that you're experiencing or going through. I just think it's also really important because if there's a change in, say, you notice a lump or something in your breast, you want to feel comfortable coming to them about that, because if not, then you're waiting, you're prolonging that period of time that you could potentially have cancer, and then it's harder to treat later down the road. So it's just really important to have that good relationship with your primary care provider. And if you don't, I really encourage you to strengthen it and find someone that is fitting for you and makes you feel comfortable.
Thank you, thank you.
Can I say something in relationship to that? That absolutely right, Jayla, the importance of a primary care physician. Unfortunately, for many women in underserved communities, that does not exist. And it really becomes important if someone is diagnosed with cancer, breast cancer, any other kind of cancer, because typically your treatment team is going to be someone that you first met, haven't had any prior relationship with, so it's going to take a longer time to develop that trusting, caring relationship to talk about some of the things that you are experiencing. But then on the other hand, it's also important that if you do have a primary care doctor and have a good relationship, you're better positioned for that primary care doctor to help coordinate your care with your cancer care treatment team, which is important, particularly if you have any other chronic conditions or any other health conditions that might be impacted by your cancer treatment, to keep that primary care doctor in the loop so that you're getting holistic care. And then also important, once you finish your cancer treatment, you still need to be followed, not only by your cancer treatment team, but coordinating that again with your primary care. So it is sort of seamless, but it's looking at the whole picture. So a lot of times that cancer treatment team is looking sort of with blinders and only what is, what they're doing to address the cancer, but not necessarily looking at some of the other health conditions that you may have already had or that came as a result of the cancer diagnosis.
Thank you, thank you.
Mm-hmm.
And when it comes to an opinion, there is sometimes a misconception that people shouldn't get a second opinion when they're diagnosed or when they're getting detection or other screenings. How can someone get a second opinion, or what is your thoughts on that? Anyone can answer.
Oh, I'll go again. It's a couple of thoughts about that. One is that it's absolutely fine to get a second opinion, particularly as your own self-advocate, for no other reason than for your own peace of mind. Even if you're good with the first opinion you may have gotten, and you trust that. If you have any misgivings about that, it's just better to get that second opinion to try to resolve any kind of questions that might still be lingering. The other thing that in the advocacy seat that we often say is that, if you go to someone, a doctor, and then you say, I want to get a second opinion, if that doctor is resistant to that or critical of that, that's probably not the best doctor for you to have. Any doctor should be okay with you going out and seeking a second opinion. And if they're not, you probably should rethink that relationship.
Thank you, thank you.
Mm-hmm.
What are some ways for those to advocate for themselves when it comes to taking action at home?
So I'll take the approach of advocacy towards policy, right? And I'll let Lisa talk about patient navigation and patient advocacy, navigating for yourself as a patient. But with the Cancer Action Network, American Cancer Society, we have tons of ways that people can advocate at home from their computers or with us at the State House for stronger policies around early detection. We'll talk probably about this a little bit more later, but a big bill that we have at the federal level right now is the Medicare Multi-Cancer Early Detection Act, which, while there's still some more research that needs to be done, this will increase the amount of evidence-based coverage processes for multi-cancer screening tests once it's approved by the FDA and open it up to Medicaid and Medicare. It will also give the Secretary of Health and Human Services initiative to create this evidence-based coverage process for multi-cancer screening. So currently, like, the tests that are covered are breast, cervical, colorectal, lung, and prostate cancers, but this early detection test would open up the doors to 50 plus different types of cancers to be screened at once. So that is something we're advocating hard for at the policy advocacy level. That is something we can get everyone involved in, and I'll make sure to get my contact information if that's something you are interested in advocating for.
Thank you.
You know, from the patient seat, our sort of our rule of thumb in our advocacy is to tell women, when you have an encounter with a healthcare provider, if you cannot leave that encounter and go home and share with your spouse, your partner, a family member, what happened, what the doctor said, what does it mean, what are we going to do as a result of that? If you can't do that, that has not been an effective encounter. And it's not the patient's fault, it's not necessarily the provider's fault, but for whatever reason, it wasn't a good outcome from that encounter. So that's sort of the rule of thumb we say. You know, if you're there, until you can, ask and get your questions answered about everything so that you can then tell a family member or trusted friend what's going on, that hasn't been a good encounter. But then one of the ways to try to ensure that is your preparation before that clinical encounter, kind of having in your mind what questions you want to ask, taking someone with you if you need to, because it's always great to have a second set of ears and eyes, particularly if it's like a consultation right after a diagnosis. Your head is spinning, and so you want somebody to be there to help you remember to ask questions and also help you remember what was said. And it's okay even if you want to record that, like on a phone. And again, if there's some resistance by that provider to you doing that, you might want to rethink that provider relationship, because really it's all about being able to go back home, listen to that again, and then if you get clarity on things that were said, or if you have lingering questions, you'll be better positioned to answer those questions.
Jayla, do you have anything to add?
No, I think they covered a great deal, so I agree with everything they said.
So what does advocating for your health look like when it comes to a community member or those that that you care about, friends or family?
Well, I think a lot of my previous answer kind of covered that. The other thing that I will say is, when you're in an encounter with a healthcare provider, it's okay to say, can you repeat that? Or can you explain that in a different way so I can understand? Or do you have any other materials that might help me understand what the recommendation is? Or do you have, and thinking about how do you best take in information? So some of us like pieces of paper and go home and read it and absorb it. Some of us like that one-on-one encounter. Some of us would prefer to see a video. So it's absolutely fine to say, do you have this information, in another medium that can maybe help my understanding? And again, if that doctor or if that staff is not really helpful in that way, probably not the best place for you to be. And I mean, I know I've said that repeatedly, and I know I acknowledge it's sometimes hard to find the provider that's just right for you, or because there are other barriers like insurance and so forth. But to the extent that you can, I mean, that doctor-patient relationship is key to your health outcomes. And so as much as you can do to make that a good relationship, probably the better that your health outcome is going to be.
Thank you. So where do you see the future for early detection, or how can we improve? When it comes,
I thought Jayla might jump in on this, because I think a lot of it is tied to research and identifying, you know, different tests and other methodology to for early detection, but then also just bringing a word as an education to the community at large. I think, I can't remember which one of the other panelists said earlier about just the idea of letting people know that the sooner you know something, the better that you can handle it. You know, in my teaching, I often say to people, don't let any fear of a diagnosis paralyze you. You know, if something's there, it's there whether you have the test, it's there whether you tell anybody, it's still there. And if you don't do anything about it, it's growing, and it's just going to make it more challenging for that to be treated. So early detection is the key, but even before that, prevention is the key. And so I'm thinking that a lot of these, the direction that we're going, like in the multi-cancer early detection tool, and you know, other things that have been developed through research, we're moving more into the area of prevention. So through these tools, if you can identify earlier when somebody is more susceptible to a particular type of cancer, or like I was talking about earlier with the risk assessment tool for Black women, if through that tool, you know early on that you're at a higher risk for breast cancer, then there are things that you can do that are both preventive, or at least as a surveillance in order to detect the cancer earlier. So if you're at a higher risk, maybe you should be getting mammograms more frequently than once a year, or maybe particularly because Black women are diagnosed with breast cancer at a younger age than white women, then maybe if you're also in a higher risk for other factors, you should start getting mammograms before age 40. Or you might need to have other testing like MRIs and breast ultrasounds that collectively can more quickly identify if there is a breast problem.
Yeah, I totally agree with you. And to add on to that, along with like the MRIs, the early mammograms, if you know that your family has a history of breast cancer, for example, your sister had it, your aunt, your grandma, your mom, then there's probably something called a BRCA gene that you or your family members potentially have, especially if you're diagnosed at an earlier age than 40. So making sure that you and your family are going to get those tests. And so that'll help you ensure that you're taking preventative measures to decrease your chances of getting that cancer as well. But also there's a lot of research underground that's going on that people don't even know about. For example, even before I started working at my company, I had no idea that was even possible to predict how a tumor will respond to a certain treatment. And it's really critical, especially in the clinical setting, when that doctor is trying to figure out how can I, or which chemotherapy would be most beneficial for this patient. And a lot of times we go to just the standard chemotherapy that we across breast, but specific treatment may not work for the next patient. So developing these different types of things in the lab is important and critical. And I think it's going to better understand cancer and hopefully prevent it and come up with a
I'm
cure.
so glad that Jayla mentioned the genetic testing, which I had not mentioned, but I think that is important to know for a couple of reasons. Like she said, if there's that family history, there could be a possibility that there's a genetic component to that cancer. And yes, the BRCA gene is probably the one best known for breast cancer, but there are other gene mutations and other genes that could indicate that you're at higher risk for breast cancer. But I also wanted to mention that there is research that shows that Black people are generally more resistant to genetic testing. And that's another barrier and hurdle that we have to work to move beyond. Just last year, Pink Forever Ending Disparities was working with a researcher at IU that was specifically looking at genetic testing and comparing white families to Black families, who was more responsive to a recommendation to get genetic testing. And unfortunately, it showed that even if you take away cost as a barrier, that there were still reasons why Black families were resisting that. So the next step in this process is we're going to partner with those IU researchers and try to better identify, okay, what is the resistance within the Black community to genetic testing? And what can we do from an education standpoint to help move the needle on that? So is it fear about something? Is it lack of understanding about what a genetic test can show and how it could be useful to personalize treatments for not only the person that's diagnosed, but everybody else in the family, right? So the whole genetic testing and coordination with the research is really key.
Yeah, and I'll just add a little bit with this. So obviously there's still more research that needs to be done for these multi-cancer early detection tools to just kind of assess the outcomes and what that's looking like. But these will be used in addition and to complement the existing screening tests that we have. So like the mammography that we were talking about earlier, pap smear for cervical cancer, lung cancer screenings. This will be complement to that, not replace it. But it gives the ability through a less invasive procedure. So it'll be a blood test to test for over 50 different types of cancer. And that, to me, at least, right, non-invasive sounds a lot better than some of the other different screening mechanisms. So absolutely. I think there's, a lot of research to still be done, but there are so many institutions that are already working on this technology. So we are hoping sooner than later it will be available.
Thank you. Thank you all for just adding your point of view and your opinions in this discussion. So I will also ask, with detection and prevention, as we mentioned, there are barriers, one of them being education and another being financial. What other barriers do you see when it comes to women or when it comes to Black individuals when it comes to cancer?
Well, I've mentioned several times fear. It's very common. Fear of the diagnosis or fear of the cost of care that would impact the entire family. Fear about your mortality, right? Or fear about an inability to engage in the kind of things that you normally engage in. So all that, can be wrapped around fear. And many times though, the question to fear, the answer to that fear is one, education. The more you know and the more you understand about a subject matter, just the better informed you are, you can make better decisions and feel more comfortable in that. But then also to pair that with support. So yeah, it's very legitimate. Fear about the cost of something is very legitimate. So we can talk about that, but talk is cheap. Let's get some resources in to help alleviate that fear, And so when I say about myself that I'm a barrier busting advocate, I mean that's when you look at what the barrier is and then bust through that, whatever it takes to alleviate what that barrier or challenge is. Otherwise, it does us no good to kind of identify what all the challenges and the barriers are. And then say, oh, okay, you're on your own. No, let's get some support in there and the resources needed to support, women and families throughout that whole experience of, going from screenings all the way through if you're diagnosed and treatment and survivorship.
Thank you. Jayla, do you have anything to add?
I think she covered a big deal, but one thing I would just emphasize is just that support system. Especially if you don't have a big family or your family is dysfunctional or you can't rely on anyone and it's just you going to those chemotherapy treatments by yourself. It kind of makes you not even want to go through with it anymore, and it kind of makes you want to give up on it in your journey. So just having that support, I think it's really critical along the journey with cancer.
Thank you. Thank you. So we will be wrapping up our discussion so we can go to the next segment. Is there anything else that anyone wants to add in or speak about before we wrap up?
Can I go back to the financial question again, just to share that, I mean, there are financial resources out here, and it's all about connecting people with the right ones for them. And I mean, I was just thinking about it. I was in a meeting earlier this week, and we were talking about sometimes because of that sort of fractured relationship between a patient and their doctor or that treatment team, that patient is not going to feel comfortable like sharing, like, I can't come to my appointment today because I don't have a ride, or I can't pay for childcare and I have kids at home. They might not feel comfortable just giving that information. So I think it's incumbent upon healthcare systems and providers and those staffs to try to take the care and the concern and the time to kind of explore those things in a culturally sensitive way. And so you don't have to be invasive, but you can just offer things or share information. So if somebody actually needs that, that kind of opens the door for that, right? So, you know, I mentioned the assistance fund that Pink Forever has for women in treatment, but there are other organizations out here that have some similar things. It might not cover the same things we do, it might cover something else, but sharing that knowledge, or even like our assistance fund covers the cost of genetic testing. If there's a family that needs genetic testing and they're resistant to doing that because they think they can't afford it, there's a resource for that. And then if we don't have it, we're trying to direct them to other potential resources, whether it's for genetic testing or anything else. So, and there's also some of the research companies and manufacturers of like these genetic tests have programs that will help families pay for it. So like I said, there are resources there. It's all about knowing and sharing the information. Right.
Yeah, and I think I'll just add to kind of wrap it all up. We know it's proven through research that early detection leads to better cancer outcomes, which means in the long run, fewer lives lost. But lack of screening for a lot of the types of cancers, we talked about the other traditional screenings, but there are obviously dozens of other cancers. Usually they're detected at later stages, at which point the outcomes are much poor. And we know that there are disparities that persist in cancer mortality rates, and accessible early detection tools will help decrease those disparities and make it more accessible for people to be diagnosed at these earlier stages when outcomes are better.
Thank you.
I was just gonna add one more thing.
Yes.
I would just say to listen to your body. Like if there's anything that you feel is off, even if it's just something minor, listen to it and go get it checked out. It doesn't hurt to go to your doctor and say, hey, this is going on. And if it turns out not to be anything, cool, even better. But just making sure that you're going and getting checked out for everything, every little thing, because you just never know what it might be.
Thank you. Thank you. Alrighty, so now we will move to the last segment. So we'll have a point of view from a cancer survivor and also a dear family member of mine, Miss Crystal Taliefero. So isn't she just so cool? She's just so cool.
Do we get to hear her sing?
Ooh.
La, 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 la.
So I will start just so we can get to know you a little bit more. When were you diagnosed, or why did you go in for a screening?
Well, I was considered high risk because my mother had breast cancer twice, stage 4. And my mother's aunt, which is my second aunt, she had breast cancer. It runs in our family. And so I was considered high risk. So I would go twice a year for mammograms. And I religiously stayed on it until one time my OB decided that I didn't need to come twice a year. I don't know why, but that's what she said. So I followed instructions. And the following year, they noticed something on the screening because now I'm doing it annually, right? And they noticed that there was a little something there and they just wanted to pay attention. So we'll just watch it. Okay. And the following year I had full, 3.5, triple negative breast cancer. So that's how I got involved. That's how it started with me. And it started at 2020, March 2020, right at the beginning of COVID, which was unfortunate because they didn't really know what was going on with COVID. So when I went into neutropenic from time to time from the chemo, they thought I was having symptoms of COVID. So they would put me on the COVID floor. And I mean, it was a challenge, put it like that. But however, I did have a good advocate. Advocate that was calling me from Vanderbilt. She was really cool. I really liked her because I really did need that. I needed that. I didn't think I did at first because at first I was like, I felt like she was being invasive, but she really was trying to help me, because I really didn't know what questions to ask. It was just crazy, and the only good thing about it was that no one was working, so I had to worry about getting fired. That was a relief. No, but anyway, thank God I had insurance, which is, outrageous, but still, nevertheless, I thank God that I was able to have that and still have it now, knock on wood. But I guess when I was diagnosed with it, and that I needed to go in immediately to have they wanted to freeze it first. So the only thing that they could do was, at that time for the particular cancer that I had, was they call it red devil. I can't remember the medical name of it.
Adriamycin.
Right. Right.
Me too.
Yeah, right. Okay, you're okay. And I had to do all 4 doses, right? And then I had to go to the Taxol after that, 8 more of those. But what they wanted to do was to basically freeze it, and then do surgery, right? So all of that went well. And what happened was, like you were saying earlier about the doctors, they assigned me a group of people, and I did not like my oncologist. I mean, his vibe was like really not cool. It was cold, and it's like he's used to doing these things. It was like I felt like a number. And so I took it upon myself to say, I said, no, if I'm paying for this, I need to get some good, some love right now. And so I went to a friend of mine I did some research. I went to a friend of mine that happened to know of a friend of hers whose husband is like, who work at Vanderbilt, and he was over the department or something, whatever. And he gave me some recommendations and basically put together the bomb team. I was fortunate. And I had the best surgeon. I had a great team. They were just no nonsense, told me exactly what to expect, whether I liked it or not. I immediately got used to needles, which I hate and pass. And and even down to the nurses that were administering the treatments. I mean, they were amazing. And just to get to that place where you can ring that bell, that's what I can think about. Is I want to ring that bell and bring it home, But the whole experience was it was tough, but it wasn't as bad as I thought it was going to be because I had that support and the love, and understanding and the good bedside manners. I mean, that really helped so much for my mental state. And then I had support from my family members. Matter of fact, she was here, Pat Millard. I mean, she actually took her time out and came down here because I didn't have anyone to help me on that side. My daughter was at school and, it's just the two of us. And so she came down here and stayed with me during that, after the chemos, where I had to go through the worst part. Another bad part was the drugs, that were administered, afterwards, painkillers and this and that. I really wanted to have that monitored. And I did not want to self-medicate, because sometimes, when you're sick, you don't remember sometimes that you took it 8 hours ago, or was it 4 hours ago? You know what I mean? If you're dealing with pain, So she was huge, and there she is. I love you, cousin. That's my sister cousin. And, that, in itself right there helped bring me through. And I also, I know COVID is a bad thing, but I mean, it kept me isolated. I'm twisted on the feelings and emotions that I have right now because it was a negative and positive going at the same time. But my faith in God, just my everything just was just heightened. You just think about your whole life. And now I'm thinking about my kid. She's 21, and the question I wanted to ask was, I mean, you guys were talking about taking early mammograms, since it is in our family, but she's only 21. So, I mean, what are the risks of her becoming sterile from taking early mammograms?
I can try to address that. That's a common concern, but what needs to be known is that the radiation used for screening mammograms is such a low dosage and such a low amount. It does not lead to increased risk for breast cancer. To me, I mean, that would be one of the least of your concerns.
Well,
more
I'm talking
concerning,
about like her having children.
Oh, well, that too. I mean, it's no, I'm not aware of any research that would show that radiation from a mammogram would cause that.
Okay.
In terms of her fertility, but
okay,
I think it is. I mean, but I love hearing that you're thinking about that, because that's probably what is a concern to her. And so the more you know and can share with her, I think the more comfortable that she could be in participating in like a high risk program. And many of the hospitals have those available. It sounds like you may have been in one yourself.
No, I haven't.
Following those recommendations.
Yeah, well, I haven't. No, I haven't. But she might want to, and I did take the BRCA test, by the way, because my mom, hers was hormone related, and I had something that completely different than any of my, aunts or my mother. It had nothing to do with it, So I came out negative with the BRCA, and I still got breast cancer. So I don't know how that works, but I guess, like you said earlier, Miss Jayla, that it could be all kinds of things from your, diet or alcohol intake. Like, I'm telling my daughter, she's college, so it's like, you watch the alcohol, watch what you're eating a little bit, she doesn't eat any fried foods. I'm not trying to get heavy on her because I don't want to freak her out, and not have a youthful life, but just moderation, that kind of thing, So anyway, that's where I am, and here I am now, and I'm 2 years out. The other thing that I want to talk about, ask about, I wrote this down here. What I did like the doctors and everything they did to bring me through on this with the treatments and whatnot. The care there was awesome, but the post care was soft, was weak. I am still disappointed about that because it's been 2 years out and I have not had my labs. So that's intense. Yeah. That's intense for me. So I think I'm going to go in there and just say something.
Yes. That's your self-advocacy. I mean, that should not be happening. And I was talking earlier about primary care doctors and their importance in coordinating that care. But then this also makes me think about what I hear a lot is after women finish that primary initial treatment and they're kind of done with that routine of chemo, radiation, and surgery, is like other people will look at that like, oh, she's all done with cancer. But no, particularly from a mental and emotional state, as well as just, it could be some lingering physical impacts. You still have to deal with that. And
there's that posting of that Miss Jayla was also, was saying, I have some side effects, you know what I mean? And they're real, and one in particular, I don't care to talk about here, but we can talk later, girl to girl. But, it's almost kind of like, they're not taking it serious, like it's in your head or something. Well, no, it's really happening. I mean, and there's nothing. I've been to 1, 2, 3, 4, 5 different doctors now, and they can't find why this is happening. So now I'm getting a little frustrated in my, I guess I would say my confidence level, I guess, is a little on the soft end right now because of it. You know what I mean? And I'm trying to figure out where and who can I go to resolve this, or at least tell me what it is. You know what I mean? So I can address it. Neil, you know what I'm talking about. We don't need to go there. But it's just frustrating not being able to find the why this is happening. So that's what I'm talking about. The post care is a little soft, and I guess you as a patient, as a survivor, you're just going to have to be your own advocate, and you have to get out there, and you're going to have to keep asking questions and keep pushing it. So that's what I'm going to do.
So as your own advocate, I know you shared your story about having the best team. If you're going to pay for it, you want to get the best because it is your life. What type of resources were provided to you during your battle?
Like I said, I did have the advocacy. I had this one, I can't remember her name, nurse. She was so cool. She kept calling all the time, and I was getting annoyed at first, but then I realized later on, I said, man, I really needed to hear this lady call and check on me, and how you doing? Just call and see how you doing. And I'm like, wow. And I said, I wish I could put a face with this name. You know what I mean? That would have been nice, But so I can thank her, because she was the only one that was really there all the time, from the staff, nursing staff, and that was really important. And you don't realize that at first when you're first going through it, but when it's over, you go, wow, I really needed to have her there. And also my cousin being there, just to have that support factor, somebody there feeding you. You don't realize that you have to go to the restroom by yourself. You can't, just these things that you take for granted, and then all of a sudden you can't do it. It's weird. But you're really gonna have to have somebody there with you. And don't be afraid. Here's the thing. Pride. Pride. You got to drop all of that, because now that's the time you're really going to have to just reach out and say, look, I need help. If you need help, ask for help. Somebody's going to come out and help you. Somebody's going to help you. Church, some member of somebody's going to help you. So don't be afraid to ask for help. And I'm saying this because I'm a witness to that. So I was guilty.
Me too.
Yeah. I hope I said enough.
I think everyone shared just the right amount. And the information and just the conversation, and how, thank you for being vulnerable to share. Thank you all for sharing your expertise and your knowledge. I appreciate it. And I know that others will also appreciate it. And just thank you again. Now I will start sharing my screen. 1 second.
Does anybody else have any questions? Pat?
Do we have
questions
or thoughts?
But 2 years after being with my wonderful sister cousin, I was diagnosed as well, triple negative.
Wow, 3 of us here.
I know,
Yeah,
it's crazy.
yeah, that was crazy. Yeah, out of the clear blue. Mammogram a year after my mammogram, it was clear, and then it just showed up. So it was in our family history. My mom's BRCA was negative, and so I'm like, oh, woo, I'm good. But it just showed up. It just showed up. And like she said, like Crystal said, don't be afraid to ask for help and be vulnerable.
Yeah.
It was difficult for me because I have many, many other physical ailments, and I just had to accept this as well. So it was really hard. The great thing is I had a great support team. My sister Georgia, Crystal, Nia's my niece, and it was good, but mentally it was hard because I already have other issues, and after 18 years of having brain surgery, it took me a while to get to a point that I just felt okay with not needing help, and now I needed help again. And it was really, really difficult for my hair to fall out. So this was the second time that I actually was able, I have a brain shunt. And this was the first time that I was able to see it in its entirety. So I think it really hit me hard to see my hair fall out. And I've always had decent hair. And I always tell people, hey, it's no big deal for your hair to fall out. My hair, you may see me today and my hair's there, and tomorrow it's all gone. But this time it was really, really different. So it hit me hard.
You know what, the main thing, Pat, I'll say this because this has really helped me a lot, is to keep a positive attitude about all this mess. Right?
Well, yeah,
because we're still here.
Right, still standing.
I think that was the most difficult time for me.
Right.
Was seeing that, because that brought back 18 years. And that was the first time I was truly just knocked out of living, I guess, a regular life. And that took me out of the normal scope of things, And it's like, okay, here, I have breast cancer. I can deal with this because I can survive this. I had that in my head. I can survive this. I can get through this. But I'm like, oh my God, I can see this other thing that just kind of knocked me out, So it's like, with all this great support around me, it made it okay. And I knew that God was going to bring me through this thing,
Yeah.
He was going to bring me through this thing. And after it was all said and done, I'm like, woo, woo, I got to ring that bell.
Yeah.
Like, it's like I went in the hospital one time, blew all my veins out. They couldn't get anything. And I'm like, oh my God, I can't get anything. My veins were shutting down. But when they finally got healed enough, now I was able to get down there. I did a dance. God gave me enough strength. I did a dance and I was able to get down there and ring the bell. I was like, whoa. But like Crystal was saying at the end, it was like, where'd everybody go? The aftercare was, it was just kind of like, it just like dropped off.
Because you do have side effects, but you can't see them on the outside or the inside.
It just dropped off. It's like, I got lymphedema in my breast. And I'm like, so who's supposed to help me with this? Where's the doctor? Who's supposed to help me with this? I got a, like this compression sleeve thing that I put on it, use it once a day, but now what doctor do I go to, you know, for aftercare for this?
Right.
What doctor handles the aftercare for the neuropathy in my foot? Because nobody's saying
Those
what,
aftercare.
you know,
Yeah.
so it's like
Yeah.
this cycle kind of thing. Where do I go from here? Now that I can
What's
say,
next?
hey, I'm a survivor.
Mhm.
Yeah.
Can I address, I know we're running out of time, but can I
Yeah.
address that really, really quickly? That there was a time that there were federal like hospital regulations that required that every cancer patient get a survivorship plan once they finish their treatment. That regulation was recently, I don't know, last couple of years lifted. So it's not required, but that doesn't mean it's not a good thing. I mean, exactly because of the reasons that you and Crystal have identified. So I just also wanted to add that Indiana has a document called the Cancer Control Plan. It's updated. We are now in the process of updating that cancer. We have in that plan the promotion of and advocacy for the adoption of survivorship plans for everybody, for every hospital to have one. And so in the coming year, you may be hearing more about our Indiana's cancer control plan and what we're trying to do and how we're trying to implement things in Indiana. So I just wanted to add that. It's kind of a little bit off subject, but obviously it's an important issue, not just for the two of you, but for many people. We hear about that, just what happens with survivorship.
Thank you.
Okay, thank you.
Thank you.
That's it.
I love that everyone's sharing the knowledge, even on topic, off topic, spreading the awareness and whatever information that you have. So I appreciate it. I know someone else will. So I will conclude this webinar. Thank you, everyone. We appreciate you being here. We appreciate everyone speaking. And if you would like to still stay connected with CWU in our upcoming events or programming, you can scan this QR code and it will take you to our website and allow for you to get updated with our newsletter and any upcoming events. You can also follow us on our social media handles at CWU Online or on our website, cwuonline.org. Our first event will be in 2023 for Coloring and Conversations, where we will focus on vision boarding and setting new goals for the new year. Again, thank you all for joining, and I hope you have a safe and happy holiday.
Thank you.
Thank you.
Thank you.
Bye-bye, niece.
Bye-bye.
Bye, everyone.